Sorry about that, everybody. We experienced some technical difficulties with our Zoom account, but we are back. We'll have Scott start his presentation over from the end. And again, this will be recorded, so we'll have everything available afterwards. Scott, you can go ahead.
All right. Thank you very much. Can you hear me? Or am I muted? No? You can hear me okay? Great. All right. Well, again, I'd like to add my thanks to the sponsors and the opportunity from the Iowa City Area Business Partnership to make this presentation on healthcare, managing healthcare costs. Year after year, we've found that health plan costs are at or near the top of the most pressing issues for employers of all sizes. And the focus of our presentation today is on small employers. That's employers with less than 100 employees. And the cost of health insurance for small employers is especially acute. Even though this group makes up the majority of the US employers, and it also creates the highest percentage of new private sector jobs each year. For health insurance purposes, small employers are at a disadvantage. They don't have large numbers of employees that are appealing to insurance carriers for underwriting purposes, known as a big pool of employees, which means there's generally a lack of insurance carrier choices. And for small employers, insurance carriers don't generally share data with them, even though it could be very helpful for small employers as well as it is for large employers to make purchasing decisions. Our regulatory environment is extremely complex, and small employers often don't have the advantage of a full-time or a specialized human resources staff that can help them navigate the benefits process. Even though you're at a disadvantage as a small employer, there are ways to control cost. I have several suggestions, some of which are more radical than others. There isn't a single formula that works.
I think Scott might be having some internet connectivity issues, but he should be back soon. It's been quite a morning for us today, hasn't it? How about just for a quick preview of what we have to come later, David, would you like to introduce yourself and why you're on with us today?
You bet. Thank you. I am David Bywater. I work with a company called Bankers Advertising and TrueArt here in Iowa City, and I was asked to talk about our experience as well as to talk about advocacy related to health care, health insurance in particular. We do have an opportunity to work towards a solution, or at least some solutions that might bend the cost curve in the, to help us as business leaders run our businesses better. It appears Scott's back, so we'll let Scott continue.
Can you see my presentation now?
Not yet. You'll have to reshare.
My apologies.
Just a comedy of errors today.
Okay, great. So as I was mentioning, my perspective is a consulting perspective. So I look at the design of plans overall and regulatory changes rather than insurance carrier specific issues and recommendations. I would recommend that you work with a business partnership member insurance broker to help you with specific carrier offerings. Their expertise can be invaluable. So the environment we're in has required businesses to adapt and refine in order to survive. The healthcare cost increases before the pandemic have outpaced general inflation for several years. It's been an average overall, including all employers, of about a 4% increase per year, which is more than double general inflation, and more than wage increases for employees over that period of time, but the situation's exacerbated with small employers. It's typically more than double that amount. And there isn't one cause. It's due to an aging workforce, increased medical and technology costs, new developments for drugs, a complex regulatory environment, and simply individuals who don't take care of themselves and have high claims. So because there's no single culprit, there's no single answer as well. In my own business, I've tried to focus on anything positive that can come from this pandemic. I do think there are two proverbial clouds with silver linings. First, and most important in my opinion, is a significant increase in the use of telemedicine during the pandemic. Faced with limited alternatives, providers have quickly adopted telemedicine practices, and regulators and insurance companies have allowed for the reimbursement. This is important because it increases access to health care for several employees. And in the longer term, it can lower healthcare costs because individuals are treated before a condition becomes more severe and therefore more costly to insurance companies and employers that finance their premiums. There's also a financial benefit of less time off for work to manage medical care with telemedicine, but that's a little outside the scope of this presentation. So the second cloud with a silver lining is the pandemic has actually lowered healthcare costs for 2020, much to the chagrin of hospitals, doctors, and healthcare workers around the country. For a period, elective surgeries couldn't be performed. And even after they could, some patients have been reluctant to schedule their procedures due to the pandemic. Insurance companies are going to have to decide what weight to give these lower costs as they look at renewing health insurance plans for 2021. There certainly will be a bubble. In other words, the care will happen later, but some services won't be performed for a couple of reasons. One, some people adapt through other processes to the changes, and other procedures like annual physicals, semi-annual teeth cleanings are going to be skipped entirely. There are a few traditional solutions that employers have focused on to control their health plan cost, and most of these have focused on cost sharing with employees. Yesterday, the Kaiser Family Foundation, KFF.org, released its annual employee benefits survey. And it mentioned that again this year, health premium cost increases outpaced wage increases and general inflation. Along with that, it noted that cost sharing has been the most common solution used by employers over the last several years. Cost sharing measures have taken two forms. The first one applies to all covered employees, and it involves an increase in the percentage of total health insurance premium that an employee must pay. So for example, if your employees currently pay 15% of the premium cost of single coverage, you may consider increasing that cost share from 15% to 20% of the coverage cost. If you consider this, you have to remember that it impacts employees regardless of health plan issues. So it penalizes healthy employees as well as those who are not healthy. The second measure, and has been the most common by far, is to increase the deductible and potentially the coinsurance and copay levels in order to lower the overall premium increase for the plan. This option impacts those with claims under the plan. It doesn't directly lower claims costs, but it can cause employees to use the plan more judiciously when they shoulder higher initial cost. It can also cause them not to seek services, which is a disadvantage. It's important to remember that for significant, severe, or catastrophic claims, employees have their liability limited by the plan's required out-of-pocket maximum. That out-of-pocket maximum doesn't apply to an insurance company, but employees are typically limited on how much they spend annually out of pocket, even though it's a big number. If you're looking to increase your deductible to lower your premiums, you should consider using a high deductible health plan with a savings option if you haven't already done so. The savings option, either a health savings account funded by the employee and potentially the employer, or a health reimbursement account funded by the employer, can mitigate the cost of that higher deductible, but it really does so over a multi-year period. It does help with tax advantages for the employees because that money is saved in a tax-preferred manner. A high deductible health plan provides protection from those severe or catastrophic claims, as well as, if not better, than another type of managed care plan like a PPO, because the out-of-pocket maximum is required by law to be at a level that's at least as low as a managed care plan. Another option that may be appealing to smaller employers that are in a single geographic location, say Iowa City, is to move the plan to a more restrictive provider network. These are sometimes called narrow network plans. And the provider network is more limited, but the premiums are lowered because discounts have been offered that are deeper by this smaller panel of providers. The main disadvantage of this plan is that they limit choice of providers to employees. And a lot of employees get discouraged if their current provider is not a member of this narrow network. While these options are very common, they're also very useful. They are more about cost shifting than cost savings. And they provide a trade-off sometimes that's not acceptable to employees, like changing your physician. If your provider is not in the narrow network, that might not help you also attract and retain new employees. So what can you do to be a part of systemic change, especially from a regulatory perspective? We're fortunate to have David Bywater on our call today to discuss his efforts and experience with market regulation of small group health insurance with his business. David, I'll turn it over to you now.
Can everybody hear me now? Terrific, thank you. Thank you, Scott. I appreciate the opportunity to be a part of this presentation. Again, I'm David Bywater. I'm with Bankers Advertising in TrueArt here in Iowa City. Our 5-generation family business makes advertising calendars and distributes promotional products and provides commercial printing to customers throughout the United States. We employ 93 people, and that number is important because it fits in the category that Scott is really focusing on today. More on that later. 63 of my colleagues are enrolled in our health insurance plan, including myself. In 2021, our renewal we received last week is an 11% average increase across the plan. What's interesting about that increase is it's actually lower than what we've experienced in the last few years. In 2020, our published increase was 18.99% for our PPO plan and 18.8% for our HMO plan. The compound rate of increase for the last 5 years for us has averaged over 20%. It's close to 20.5. And when you look at those numbers and put it into words that I think are easier to understand, what I like to say is what cost us $1 for healthcare in 2015 cost us $2.54 in 2020. Clearly rates that are unsustainable and clearly rates that have caused a lot of angst within our business, both as far as how we manage, as well as for our employees that are covered in the group. The drivers of this increase for us are mainly focused on our claims experience. We've had 3 cancer cases and we had an infant that was born with a brain tumor. In addition, we can count aging, healthcare inflation, industry factors, and other items as part of that increase. I spent some time meeting with different providers or advisors related to healthcare last fall in particular. I met with the Iowa State Insurance Commissioner. I spent some time talking to a number of alternative brokers for insurance, and I spent some time at Wellmark with their executive team talking specifically about the insurance marketplace. It was an interesting set of time that I spent, and I've also now spent some time with our legislature. Here's what I've learned. There are 3 main drivers of healthcare cost: capacity, utilization, and magnitude or intensity of use. Capacity or the availability of services has remained stable in Iowa, and utilization, the number of care opportunities, has also stabilized. However, the magnitude and intensity of cases has increased dramatically. Some believe that this is because there's no lifetime maximum on insurance claims now, which means higher charges are available for everything, including pharmaceuticals. They've got the opportunity, so they charge more. For all companies, at least 1 out of 5 years will show a negative health insurance experience. When this occurs, there's no cap on claims, there's no cap on potential rate of increases, and nearly unlimited exposure for the business. When rates go up, the employees that share in those increases will experience a rate increase also. When the increase is substantial, the impact to the family budget is substantial also. Substantial increases in insurance costs put further pressure on the business due to potential penalties related to the Affordable Care Act requirements, particularly in the area of plan affordability. Now, there are roughly 500 mid-sized insurance or mid-sized groups in Iowa, insurance groups. In other words, employers that are in the 50 to 150 eligible participant range. These groups are rated based on their group dynamics and their claims experience. Typical rate increases for 2020 range from 6 to 9% for this group. We haven't seen what 2021 is yet. However, this is considered the worst market in the state of Iowa as far as those rate increases are concerned. And so many of the businesses on this call that fall into that range will see rate increases that are higher than average based on that strata of the insurance marketplace. The insurance commissioner noted that the insurance division is focused more on the individual market than on the business marketplace. In other words, the group plan side of the equation. If you look on the public insurance exchange, you'll see very limited options available for people that want to purchase insurance there, and they are on average much more expensive than what current employer plans are. In other words, it's much better to be part of a group plan. For insurance companies, up to 85% of their revenue dollars are spent on claims. The net margin for those insurance companies after paying out those claims should be between 0 and 3%. Small groups of 50 to 100 employees are more likely to be impacted by claims because of the size of their pool. Influence on claims or influence of claims on insurance rates is not necessarily a 1-to-1 ratio. Part of the claims experience for groups of this size, in other words, in that 50 to 100 category, may be temporarily pooled with other groups within the insurance company. But the biggest issue here is that insurance companies are tracking individual company claims experiences over the course of time and expect to receive more premium revenue to cover claims over time for that individual company. When claims exceed premiums, the difference is a factor in setting near-term rates. It is rare for rates to go down, but it happens when the long-term trend on rates, or claims, I should say, is less than 85% of premiums over the course of time. This business model does not allow large claims to be treated outside of the individual insurance pool. The current experience ratio for our company is 115%. Our Wellmark plan is paying $1.15 for claims for every dollar in revenue that was collected in 2019. We will continue to pay higher rates with higher rates of increase until our current experience has been covered and our ratio of claims to premium returns to 85%. So in other words, because of our pool and because of the experiences that we have, Wellmark is going to collect from us related to those claims until they've covered that experience. Iowa insurers formerly had a shared pool resource to address large claims as a reinsurance method to allow claims to be covered with less of an impact on individuals or groups. A single large claim, therefore, would not hurt individual plan or affect the coverage of participants. In 1992, the Iowa Code formally allowed this type of reinsurance program. Under today's model, it is apparent that insurance companies are working to minimize their exposure to any high claims. When applying for coverage, they insist on receiving a list of prior health experience and employment data to be able to provide a window into the applicant pool that they may insure. This is very unique to this particular industry. And I like to say, I don't get the chance to see what my customers are paying for printing before I decide what I'm going to charge them. But the health insurance industry does. There's no cap on rate changes related to experience, and there's limited chance for the insurance company to review and deny claims or suggest alternative services. With one of the cases that I mentioned above, the chief medical officer at Wellmark claimed that if that particular person needed 50 surgeries, he would get 50 surgeries and we would pay for it, meaning Wellmark. And then the cost would be reflected in our rates and paid by the insurance companies and the plan participants. All of this suggests problems with the current Iowa business owners who are exposed to bad luck with their insurance pools. With no cap on rate increases, businesses are at risk for substantial increases like ours over time. There appears to be limited remedies for experience such as this. Something needs to change as the economics suggests more participants will drop out of the current system over time, adding to pressure on the system as it currently exists. My goal in my work that I'm doing related to this is not to shift the insurance burden to the individual, but to look at the present system and examine why it currently does just that. It concentrates the burden for large claims on a finite set of members of a small insurance pool. In our case, 62 families will share the burden of the large claim we are currently experiencing. With the rise of rates causing families to choose, when we will raise rates, in other words, because of the plan, causing families to choose to pay them, leave the plan for insurance elsewhere, or go without due to affordability. Because of the 20.5% compound rate of increase on our plan that I mentioned earlier over the last 5 years, the plan is now unaffordable for some of our families. I believe this concerns everyone. Over the course of time, all businesses will have some similar experience. It is inevitable based on the current rules of the Affordable Care Act. To survive, a company will need to stay either under 50 employees, where the experience is not part of the insurance rating, or they need to grow large enough to have an adequate pool to handle this risk. Scott alluded to that in his comments a few minutes ago. We will also need to scrutinize who is in each pool. This is occurring already when we talk about things, and you may have heard this from your broker about adding a spousal surcharge to your plan when that spouse has the opportunity for coverage elsewhere. Here's the interesting thing. The Affordable Care Act was originally written and signed into law with 100 employees being the threshold for claims experience to begin affecting insurance premiums. Small businesses were defined as those under 100 employees. With less than 100 employees, a company is rated for insurance only on its demographic information and not on claims experience. In October of 2015, the Protecting Affordable Coverage for Employees, called the PACE Act, was enacted into public law. This law generally redefines a small employer for health coverage as an employer who averages 1 to 50 employees during the preceding business year. Under this act, states have the choice of defining small employers as either 50 or fewer or 100 and fewer employees, and therefore determining claims experience becomes a factor in setting insurance rates. It appears Iowa has adopted the definition of 50 employees or less constituting a small business. Our company experience suggests that an insurance pool with less than 100 people is too small to cover negative claims experience such as ours. Employees with 50 or fewer employees are lumped together for ratings purposes and claims experiences, therefore having a broad pool to spread the risk over. These groups are effectively sharing costs without being in a combined plan or pool. They're doing so because of how the rating system works. The PACE Act allows more employers to fall under this type of coverage. I'm therefore looking to determine if business owners are interested in lobbying the legislature to consider whether to adopt the definition of a small employer to be those with 100 or fewer employees as allowed by the PACE Act and as originally defined in the Affordable Care Act. I'm also trying to determine if there's a possibility to reestablish a state-based insurance program for high-risk cases to underwrite some of the risks that the insurance companies might be having with some of these experiences like ours with the person that I described earlier. I would like to find similar protections that previously existed for insurance plans to minimize the business risk and therefore help to minimize the rate increases. I'll close by simply saying the purpose of insurance is to spread costs over time and to cover a large number of participants so that costs or claims do not hit an individual or an individual company too hard at the time of occurrence. As discussed above, I'm looking for a remedy such that business leaders like me can focus on our customers and our markets without having to worry about ever increasing insurance claims consuming our business. And Scott alluded to that in his comments when he started. If you'd like to discuss this further, please contact me. I'd be willing to visit. I'd love to hear from you about your individual story. Thank you.
Thank you very much, David. I just might add to that from my perspective, you don't just have to be an employer that has more than 50 employees to 100 employees to be impacted by this. This is advantageous to groups that are smaller than 50 as well, because when combined with the larger group, that pool can better absorb losses. In fact, several surrounding states have taken the federal level of 100 for their small group pools. So there's an advantage to all smaller groups to work together on this. The other thing I just would add from a systemic change standpoint is one of the biggest advantages I've seen with small businesses is that people have a higher level of trust in small businesses than they do in large businesses, which increases the value of their voice. And that really helps when you communicate with policymakers, as David probably has noted better than I have. But so you should leverage that trust if you can. And it's also one of the advantages that I personally have seen for my membership in the Iowa City Area Business Partnership, and they're able to amplify your voice as an advocate as well. So I hope you'll take up David's offer to try to address this issue, because as he pointed out, it's a big issue for a smaller group of people. It's not as high a priority as the individual marketplace, and it needs to be, because businesses are the driver of growth in the state. So that's my addition. So please do contact David as well. Thank you for your comments. Very helpful. So I've got a variety of plan changes to suggest to you that I think can be helpful to small employers, and some are more radical than others, as I mentioned before, and some may not be necessary, or they're not workable within your company structure or within your company culture. So hopefully you can take something to consider out of some of the more significant changes I'll recommend. So wellness programs in general have been around for quite a while, and the general focus on well-being and preventative medicine can help lower claims costs in the long term. Personally, I believe that providing a health risk assessment to employees and adult dependents is very valuable, since these assessments can help individuals identify increased risk for chronic conditions and high claims, and those risks may not be known. Some carriers will offer these health risk assessments as a policy perk to get your business. Others will offer it as an add-on benefit that you need to pay for. And they're also offered by several third-party providers, including local healthcare providers in our region. And these services can provide you with some of the aggregate data that insurance companies won't provide you with, and can help you maybe tailor a program that identifies some areas of risk and provides some recommended actions. And that second step is critical, in my opinion. It's to provide help for those who either have chronic conditions or are more susceptible to develop chronic conditions. What I've seen in my experience is the 80-20 rule does apply in the healthcare setting. 80% of your claims usually come from less than 20% of your employees. And so this chronic condition help can take different forms. You can pay for programs like subsidizing smoking cessation or weight loss programs. You can provide diabetes education, or you can engage with a health coach for certain employees. It's often a service of wellness program providers, and they work with the individual at risk. And the idea is it'll help with compliance and increase with success. And if your insurance provider allows the flexibility, you can reduce or waive deductibles for certain medications associated with chronic conditions in order to ensure that individuals aren't skipping getting these medications due to financial constraints. And that's particularly important now. If you have a high deductible plan with the savings option, you want to be cautious and make sure that your plan design change doesn't disqualify for the plan from tax advantages, because that high deductible has to apply to all claims. But federal rules recently have changed to increase the number of items that are considered preventative, and that allows the health plan to pay for services before the employee meets the deductible without disqualifying the plan. As a compliance guy, I think it's better to be safe than sorry, so it can work with high deductible health plans. Another potential solution is to look at investing in a concierge doctor. And concierge medicine has increased in popularity in recent years. A concierge doctor, in general, provides care to a smaller group of patients, and the patients receive enhanced access to care and more personal attention. Many of these type of providers offer 24 hours a day, 7-day a week access, but that's for a membership fee that's not covered by insurance. But you could help subsidize, either in whole or in part, the fee cost of a concierge doctor for some of your high-risk employees. And the idea is to provide them with better access to care, like a health coach, but even more so. This is a one-to-one relationship that can help ensure preventative medicine compliance, because you're being monitored and you have access to the physician. I want to be clear that I think all doctors take a personal interest in their patients. This isn't about other doctors, but some patients, especially those with chronic conditions who see doctors more often, respond favorably to more personalized patient experience that isn't time constrained. And that's where a concierge doctor can help. A word of warning for you: if you have a preferred provider organization plan, you want to make sure that the concierge doctor is an in-network provider. If your health plan costs need more aggressive changes, or in other words, you're considering the alternative of getting rid of healthcare coverage, you should consider a couple options before you eliminate coverage. If you want to lower both premium and claim cost, consider changing your coverage for dependent spouses. Dependent spouses have more claims costs than dependent children, and oftentimes more than employees. If you eliminate coverage for them, you'll save money. It's not an alternative that's going to help with your employee satisfaction, though. So I recommend you consider it as an alternative to eliminate coverage. Another alternative, but not nearly as effective, is to adjust your premium cost share to charge an employee more premium if their spouse is eligible for coverage of an employee, as an employee of another company, but doesn't take that coverage and is on your coverage. And that's a pretty radical idea, but it can work. On the other end of the spectrum, if you have enough liquid capital, and I know that's in very short supply during this pandemic, you can consider retaining some claims cost by partially self-funding your health insurance. For smaller firms, there's been an increase over the past 5 years in what's called level funded plans. And they are a partially self-funded plan that has a small portion of retained liability and a lower stop loss point for employers, so risk is limited. And what is advantageous about a level funded plan is it eliminates the disadvantage of self-funding, a major disadvantage, which is the variable claim liability impact on a small employer's cash flow. In most situations, this probably isn't a good option for employers with fewer than 30 employees. That's my opinion, but you could talk to your broker about that. The idea that I have on this slide demonstrates what a difference 9 months makes. At the beginning of the year, when there was record low unemployment rates, I would not have recommended you look at the makeup of your workforce and eliminate some. Now, with around 5% unemployment, it does make some sense to determine if you can benefit financially by outsourcing some non-core job functions within your business. The savings are from payroll, but the benefit costs are a big part, and a big part of that is healthcare insurance cost. So the other reason I mention this now, even though it's not directly an insurance plan issue, is because the Department of Labor just released some revisions to its independent contractor status for public comment. You always face a risk that the government may classify someone you have considered an independent contractor as your employee. And we're hoping that that risk can be reduced by revised rules. Again, it's a regulatory change. This isn't a specific change to your healthcare plan, but it does change who's eligible for coverage, and that can potentially reduce your cost. In David's example, if you have less than 50 employees, you have some protection that's not available to you if you're a larger employer. The last area that I want to mention is pharmacy benefits. Many small employer healthcare plans have integrated prescription drug programs. As new specialty drugs are developed, costs have increased. And pharmacy benefit costs have been the fastest rising cost for health plans for several consecutive years. Part of the issue, in my opinion, here is that small employers often can't get data from insurers that details the claims cost of their plan. So absent this data, one can conclude that focusing on one of the fastest growing costs may do a better job of cutting claims cost than focusing on other areas. So the problem is a particularly thorny issue with high deductible health plans. And that's because the member, when they're in the deductible area, doesn't get the advantage of the discount or rebate while in the deductible corridor. So for example, if a prescription medication costs $600 and there's actually a rebate from the manufacturer of $200, while in the deductible area, the plan or the pharmacy benefit manager gets the $200 rebate and the member pays the $600 for the cost of the medication. So there's no credit for the rebate. So this is more radical, but you can eliminate your prescription drug benefit if your carrier will allow. Your insurer may not allow you to carve out this benefit, but it's not going to be popular with your employees if you get rid of a pharmacy benefit. But if it's done as an alternative to eliminating coverage, it's an alternative worth considering. And prescription discount cards have been reasonably effective as an alternative if you do carve out your prescription drug coverage, and it doesn't impact coverage if you're for drugs that you have if you're in the hospital. It's only outpatient drugs, which are the significant portion, but only outpatient drugs. So to briefly conclude my comments, I think it's best to work with your employees to stress preventative care. And if you're going to make changes, particularly radical ones that I've recommended, talk to them about it and explain your reasoning behind the changes. We're cutting the spousal benefit because the other alternative is to eliminate the plan. And also confer with your insurance broker about these ideas and ideas she or he may have, and for information on carrier specific suggestions. And contact David. Remember to advocate for regulatory changes. In the long run, they can help you. Thanks for your time, and I can answer any questions at this point in time. Emily?
Alrighty, so I will remind everybody, if you have questions for Scott or David, you can put them down in the Q&A box and I'll handle reading them out. Oh, we have one already. I'll read that one in just a second, but I did want to, coming off of Scott's reminder to contact David for advocacy, we do also have Jennifer Banta, our Vice President of Advocacy and Community Development. She interfaces with our legislators all the time, and they really want to hear from constituents. So if you collectively reach out to Jennifer and provide her with examples, she can then take them to the Capitol and show them to our legislators and say, our members, our businesses feel this pain. Can you help us fix it? Those kinds of things are very impactful and help everybody. So going off of that, our first question, you mentioned employee wellness programs. How do you prove the ROI, which most employers are asking for? I 100% believe in providing wellness, just don't know how to make the case for it.
If you know, I'd like to know from you too. It's very difficult to show the ROI because it really eliminates larger claims from your plan. I think the way that most companies that are in the business would approach it is to look at aggregate data, and that aggregate data would be from small employers and large employers that says this is the typical number of heart events you might have with employers in your region, and that type of data is available in the aggregate. And if you would measure your ROI by where you are versus that dynamic to see if your program is helping, or whatever, smoking cessation. You might have 20% of the people who actually quit smoking, which is above the average for a lot of individuals who try to quit smoking on their own. I'm generally skeptical of especially high ROIs that you see from some companies that tell you they'll give you a 5 or 10 to 1 ROI. I think it's really, do you see improvements in general health? Do you have employees engaged? Are you below aggregate marks? So that's how I measure it.
Thank you for that. I think we might be waiting on a couple more questions to be finished typing, but I have one. Personally, this might be a little bit outside the scope of your presentation, but I know we have a lot of members who are sole proprietors, and I wonder if you have any advice for them about what they could do to help themselves.
Yeah, their options are pretty limited at this point in time. I think the health insurance exchange is probably the one of the easiest places to look at options. And as David mentioned before, the options that are available are fairly limited, although major carriers in Iowa have participated in the health insurance exchange. Rates are higher, especially if you don't qualify for subsidies under the health insurance exchange. So there aren't a lot of options available for sole proprietors. I think one of the areas that hasn't emerged but may in the future is types of plans that aggregate groups, association type of health plans, but they have not been successful, although allowed since the Affordable Care Act. So I wish I had better answers for you, but there's really not much for those individuals.
Gotcha. Well, I am not seeing any more questions right now, but if people have some later, Scott, how should they get in touch with you? Oh no. I will make sure to put Scott's contact information in the follow-up email that I'll send after this. I'm afraid we're going to lose him completely. So before he goes, I will just take a moment to once again thank our sponsors. Our lead sponsor for the 2020 Breakfast Smart series is MediaCom Business. We appreciate them for supporting this program and for their flexibility with us shifting to a virtual setting, which has its pluses and minuses, as we've seen this morning. I would also like to thank our supporting sponsors, the City of Coralville and Terry Lockridge and Dunn, and our Zoom account sponsor, which is I'm On Communications. Well, going back through. Okay. Thank you all for joining us. I hope you have a great rest of your day. Bye.
Thanks, Emily. Bye, everyone.